Hi everyone, welcome back. I am Dr. Sandeep Vaidya, pediatric orthopedic surgeon at Pinnacle Ortho Center Hospital, Thane. Today we are going to talk about a fairly common and treatable condition in babies, which is called torticollis. So what is torticollis? So in simple words, it means twisted neck. The baby's head is tilted to one side and the chin often points to the opposite shoulder. Now the most common reason for this is a tight muscle in the neck. Think of it like a tight rubber band on one side of the neck, which gently pulls the head over. So this condition is called muscular torticollis. In newborn babies, you might even feel a small painless lump in that neck muscle, which is completely normal and usually disappears on its own within a few days. So which babies are more likely to get this condition? So it is often seen in firstborn babies, babies who are slightly larger at birth, or sometimes due to their position in the womb before birth. Now, while a tight muscle is the most common cause, in very rare cases, the tilt can also be because of abnormal bones in the neck. That is why it is important to see a specialist. We can usually tell the difference with a simple physical checkup. Sometimes we may take an X-ray just to be 100% sure, but often that is not needed. Now, here is the best part. The treatment for muscular torticollis is usually very simple and very effective. More than 90% of the babies get completely better with simple physiotherapy. A trained pediatric physiotherapist will teach you some gentle stretching exercises to do with your baby at home. Another great tip is to use your baby's curiosity. So place colorful toys, lights, or even position yourself on the side where the baby doesn't like to look at. This encourages them to actively turn the head, stretch that tight muscle themselves. Lots of tummy time is also fantastic for stretching and strengthening of all the neck muscles. Now, for a small number of children who don't show improvement with physiotherapy by the age of 1 year, we might talk about surgery. But please don't be alarmed. This is not the first step. If needed, we typically perform a simple surgery around the age of 3 years to release that tight muscle. The results are excellent and allow the child to have a full normal range of neck movement. So why is it so important to treat torticollis? So if left alone, the constant head tilt can cause one side of the baby's head to become slightly flat. It can also lead to slight unevenness in the face as they grow, what we medically call as facial asymmetry. So the key message is this: if you notice a persistent head tilt, get it checked out. Early diagnosis and simple treatment works wonders in cases of torticollis. If you have any concerns about your child's health, we at Pinnacle Ortho Center Hospital are always here to help. Thank you for watching.